Bienvenidos al Vermú de Nanociencia, una actividad del Festival 10 a la menos 9 que te acompañará durante 6 semanas para acercarte un poco más al mundo nano. El vídeo de hoy se enmarca dentro de la sexta semana del Vermú, dedicada a la nanomedicina. Mpho Ngoepe, investigador de la Universidad Nelson Mandela, nos hablará de toxicidad en la nanomedicina y nos presentará la química verde como solución a los retos que presenta la formulación de nanomedicamentos hoy en día. Escucha la charla, dinos qué te parece y deja tus dudas en los comentarios. Las resolveremos el próximo viernes 3 de junio a las 12 del mediodía en la mesa redonda semanal con Mpho y el resto de los ponentes de esta semana. Si quieres unirte a la mesa redonda en directo, puedes usar el link de Zoom que compartiremos en nuestras redes. ¿Quieres un vermú? Tómatelo con nanociencia.
Greetings everyone, my name is Mpho. Today I'll be presenting to you my topic, which is green chemistry in nanomedicine. I'm currently based at the Nelson Mandela University in South Africa, Faculty of Health Sciences. So a little bit of bio about myself is that I currently hold a PhD in chemistry, where I was focusing on development of a pulmonary drug delivery system for pediatric application of tuberculosis drugs. And then for my master's, I was focusing on the design of a biosensor for cholesterol detection and drug release at the same time. So the overview of this presentation is that I'll touch on the different application of nanotechnology and then focus on nanomedicine and the issue of nanomedicine in terms of toxicity. And then we look into different ways of reducing toxicity, such as safe by design. And then we'll be focusing on green chemistry innovation. Nanotechnology can be considered as a technology where we're using materials within the nanoscale range. So this technology can be applicable in engineering, energy, medicine, and electronics. In engineering, we can see that we can fabricate sensors and membrane filters. In energy, we can design more efficient solar cells, batteries, and catalysts. And then electronics, we've got better memories and photodetectors. But for this presentation, I'll be focusing on medicine, where we'll be focusing on therapeutic drug application. So in terms of nanotechnology application in medicine, it can also range to diagnostics and formation of implants. So in terms of nanomedicine, here we'll be focusing mainly on your lipid-based nanocarriers, your polymeric-based nanocarriers, your inorganic nanoparticles, viral nanoparticles, and drug conjugates. In terms of drug conjugates, here is just the conjugation of your drug to either the antibody or a polymer. And then we can see on the figure on the right that in terms of your liposomes, we've got the highest number of liposomes being FDA approved within cancer formulation, and then this is followed by fungal diseases and then antiviral vaccines. The most commonly used antiviral vaccine for now, which is the COVID-19 vaccine from Pfizer, is actually using liposomes. So we can see from progress in nanomedicine that actually liposome structure was discovered around 1964, and then we can see your controlled drug release around 1976, your targeted drug delivery system around 1990, long circulation within 1994, and then your first FDA approved around 1995. And then we can see that from there on, a large number of formulations have been FDA approved from different applications, but mostly we can see for cancer application. In terms of synthetic techniques, we can see there are two main methods of synthesizing these nanoparticles. We've got your top-down and then you've got your bottom-up approach. In the top-down approach here, we've got a big chunk of material that you actually break it down into small pieces to make your nanoparticles. You can use your laser ablation method as one of the example. And then in the bottom-up approach, this is where you just apply your basic chemistry, where you're starting with a reagent and then you build it up using salt gel method in order to make your nanoparticles, or you can even use spray pyrolysis. But for this presentation, we can see that there's a new change in terms of synthetic techniques where we can actually use biological methods to design these nanoparticles. So this falls under green chemistry, as we don't use any chemicals that are toxic. As for these materials are actually biocompatible by coming from biological different sources, and also they are saving energy because we don't need high energy in order to synthesize these particles. So the problem with nanotechnology is that, similar to any form of reaction that one does in the lab, is that we are actually going to be exposed to the materials that we're working with, and also the people outside are also going to be affected by these materials when we're disposing them or when we're actually busy synthesizing them. For example, we can see that during formulation, the person who's working with the materials can actually get occupational exposure, and then when we actually filtering this material by working in the fume mode, we can actually get them getting out into the environment, which is why it's crucial to make sure that whatever fume mode that is being used is got a filtration system that is actually able to capture these nanomaterials so that they don't get released into the environment. And then we can see in terms of disposal of these materials, we have to make sure that actually they are not toxic to environment. As we can see in terms of waste management, we can see how antibiotics are actually being released into the environment, either through water from the sewage or from agricultural application, which is actually going to be a problem by creating antibiotic resistant strains. So in terms of nanomedicine toxicity, we can see that there are different physiochemical properties that are actually affecting our materials. How are they going to act in the body? We've got your size, we've got your shape, composition, aggregation, surface, and charge. In terms of these properties such as your charge and shape, we can see that they can actually cause damage to your cells, either damage the cell membrane or can even damage the lysozyme. And then we also got composition, which can actually affect your cytotoxicity and also genotoxicity. Here we can see that generation of free radicals can actually lead to damage of the DNA, either the nucleus DNA or the mitochondrial DNA. And then we're also going to have an issue in terms of degradation of these nanomaterials. Sometimes these nanomaterials can also accumulate in the body, which can actually exhaust the organs wherever they are trapped, such as your lungs, where you've got your silica particles caused by silicosis. In terms of safe by design, we can see there are different ways of making sure that the materials that we actually forming are actually safe when we're going to apply them. Here we can see we've got coating, doping, aspect ratio modification, and surface chemistry modification. In terms of coating, we can see that if you've got your carbon nanotubes visually not coated, it can actually lead to damage of the lysozyme, which can actually lead to inflammation and fibrosis. In order to avoid this issue, is that we can actually coat your carbon nanotubes with a material that will make them more biocompatible. Therefore, we're going to have intact lysosome. Therefore, we've reduced toxicity. In terms of doping, we can see with zinc oxide nanoparticles that if you're using zinc oxide nanoparticles, the moment they start releasing ions within the cell, this can actually lead to oxidative stress and also cell death. In order to overcome this issue is that we can actually dope these zinc oxide nanoparticles with iron, therefore reducing the rate of dissolution of the ions into the cells. Therefore, we'll be reducing toxicity. And then in terms of aspect ratio, we can see here we've got your selenium oxide nanorods. If the dimensions are too high, we can see that we can actually lead to damage of your lysosome. So in order to reduce this issue is that we can actually reduce the aspect ratio of your nanorods. Therefore, you don't damage your lysosome. Therefore, you have reduced toxicity. And then the issue also in terms of charge, we can see if we've got strong cationic particles on the surface where there's a strong charge, this can actually also lead to lysosomal damage. So what you want to do is to fabricate anionic nanoparticle surfaces where you will be able to have intact lysosome and you have reduced uptake and also reduced toxicity. However, that method actually, it means that whatever method you have used to synthesize your nanoparticles, it's probably also toxic, because now we're just making sure that the materials, when you apply them, they're not toxic. In order to avoid all this issue, is to make sure that every material that you're using is biocompatible or renewable and is also safe. And you also make sure that with energy issue that is happening worldwide, is that whatever method that we're using, it uses less energy, and make sure that we've got access to good number of resources, is easily disposable or recyclable, and also we minimize the toxicity of the byproducts, or if there's any waste, we make sure that it's also not going to be toxic to the environment. An example of the best application of green chemistry is to use starch in order to make your nanoparticles. Starch is readily available from either from waste or from plants or from agriculture. So here we can see that through hydrolysis we can be able to make nanocrystals. Through regeneration, then precipitation, we can make nanoparticles, and then through mechanical treatment using microfluidizer, we can be able to form nanocolloids. So this is just an example of how we can actually generate particles that are actually biodegradable, that are safe, and also not going to be an issue long term. So as I've mentioned, the biological synthesis is one of the upcoming methods that are actually being looked as a way of creating nanoparticles. We can see here we can actually use plants, we can use microorganisms. So you take the extracts from these biological sources and then you mix it with your metal salt in order to make your nanoparticles. So the phytochemicals that are actually within the microorganisms or the plants, they can act as the stabilizer and also as a keeping agent. And also because these biological sources, they also sometimes have medicinal properties such as plants. These properties can actually be carried onto the surface of these nanoparticles. So we can see that after characterization, we've got different applications such as in the field of medicine, food packaging, agriculture, and wastewater management. In terms of saving energy, we can see here that based on different sources which are easily available, we've got honey, kidney beans from agriculture, we've got latex, lemon juice, lignin from biomass. We can use different synthetic approaches which are actually saving energy, such as your microwave or ultrasonication, or even using hydrothermal or solvothermal application. Here we'll be able to actually generate quantum dots which are actually applicable for bioimaging or even drug delivery system. In terms of natural biodegradable polymers, these are better than synthetic polymers actually, as they are easily biodegradable. So by looking into higher plants, we have seen how we can use starch to make your nanoparticles, and then currently we've got even animals where you can get your chitosan, microorganisms where you get your dextran, and then you've got algae where you can get alginate. So in conclusion, we can see that we can actually be able to remove toxicity of nanoparticles by means of safe by design and green chemistry. So it seems like from now on it's possible to actually generate nanoparticles that are biocompatible, safe, and also non-toxic. Thank you.